Hello, my name is Dr. Joshua Kerstein. I am board certified in internal medicine, cardiovascular diseases, as well as nuclear cardiology, and was privileged to join the Maimonides family in 1995 as Associate Director of Clinical Cardiology and the Director of the Cardiac Step-Down Unit at Maimonides Medical Center in Brooklyn, New York. My medical training started off, I was actually raised and grew up in Brooklyn. I initially started in Yeshiva Rabbeinu Chaim in Berlin. Then I went to Brooklyn College and got a Bachelor of Science in Computer Science and actually went pre-med at that time. I always had a liking for medicine and thought that I would want very much to be a physician. So subsequently, after I went to Brooklyn College, I went to Downstate Medical Center and did my medical school training there. And then for my actual training in medicine, I picked cardiology, and I did my medical residency as well as cardiology, both at Maimonides. And I feel that my education was superb. There are some of the best physicians in the field of cardiology here at Maimonides, and I've learned a tremendous amount from my background in cardiology by doing my training here at Maimonides. I felt that with my love of cardiology that I could really make a difference. I think that the medications are great, the procedures are wonderful in terms of angioplasties and bypass, but if we could do a better job in terms of prevention, I felt that I could make a mark. And that job is based on education. I always enjoy teaching, and I feel that when I discuss these problems with my patients, I'm trying to educate them to live healthier and better lives. It is easy to exercise. Just one doesn't realize that by exercising, you could actually prevent serious problems. It is not difficult to be on the appropriate diet. The problem is people don't even understand what diet they should be on. Smoking, as far as I'm concerned, and many of us in the medical community are convinced, is linked to cancer, heart disease, and many other complications. But people feel that they will never get this problem. So you have to educate patients. And I also take pride that in this day and age, I always say educated patients are our best customers. My special interest is first patient management, treating patients in my office. But my other interests are, I'm the director of the step-down unit, and I do daily rounds at Maimonides Medical Center, and I enjoy very much teaching. So I'm teaching the young house staff how to fight this dreaded disease and actually improve patients' lives. That's number one. The second thing I'm interested in is actually focusing on echocardiography as well as nuclear cardiology in terms of detecting and prognosticating what our patients' future lies in terms of heart disease. And finally, specific disease states that I'm interested in is myocardial infarction or heart attacks, congestive heart failure, as well as arrhythmias, which are irregular heart rhythms, such as atrial fibrillation. I think if I had to summarize what my treatment philosophy would be, it would be prevention, prevention, prevention. Like I said earlier, we're doing a great job in treatment, but we're really not doing as good of a job in terms of education. As far as I'm concerned, when I talk to a group of people, not necessarily patients, I try to tell them that in this day and age, everybody should know what their blood pressure is like, what their cholesterol numbers are, do they have diabetes, is it well controlled, do they exercise. The recommendation by the American Heart Association is one should exercise 20 to 30 minutes a day, 6 times a week. That doesn't sound like a lot of time in a 24-hour day, but unfortunately, many people in our community are still not doing that minimum amount of exercise that they should. And by controlling hypertension, controlling diabetes, controlling our cholesterol, we could significantly reduce the risk of heart disease. Cardiology has been an exciting field for many years, and there have been new developments all the time in cardiology. Probably the biggest development is the use of stents when one undergoes an angioplasty. Angioplasty is the ballooning of an artery that has atherosclerotic or cholesterol plaque in it. So what we do is we inflate the balloon, dissolve the cholesterol blockage, and then afterwards put in a stent. What we used to tell our patients is after an angioplasty, there would be a 30 to 40% incidence of the artery blocking down again, what we call restenosis. With the advent of stents, that has significantly been lowered to around 5%. I think, is one of the biggest developments in cardiology. The other thing just came out last week. Millions of people in the United States have an arrhythmia called atrial fibrillation, an irregular heart rhythm. When one has atrial fibrillation, they're at increased risk of developing a stroke. So they may require a medication called Coumadin. Coumadin is a blood thinner, but the problem with taking Coumadin is one has to take frequent blood tests. There are a lot of drug-drug interactions, as well as drug-food interactions. The FDA just last week has approved an alternative drug to Coumadin that no longer will require frequent blood tests, will not have any drug-drug interactions or very few, and there will be no concern of drug-food interactions. I believe that this is a blockbuster new development in cardiology that will benefit our patients, shorten the length of stay, and make it much easier for them to be treated for this prevalent disease called atrial fibrillation. As a new patient coming to my practice, I would like to convey to the patient that I try to the best of my ability to stay up to date with what is current in cardiovascular treatment. Many things, like I've mentioned earlier, have been updated only recently. And if one goes by the old school, you're really missing a lot of new developments in the treatment of cardiovascular diseases. The other important point is when you come to my personal practice, you're not just coming to Dr. Kerstein. You're coming to a group of physicians here at Maimonides that are second to none.